we have Dr. BEENA UNNIKRISHNAN with us. She is the professor of general medicine and honorary senior consultant in nephrology, and she has interests in nephrology. Other than that, she is interested in diabetes and has done courses in data science and business analytics and artificial intelligence in healthcare. So over to you, ma'am.
Good morning. Thank you, chairpersons. I wish to thank Win India and the organizers of Win Kylie chapter for giving me this opportunity to talk about AI and ChatGPT in nephrology. Are we geared up for the change? AI and advanced language models are revolutionizing various aspects of healthcare. The integration of these technologies offers significant potential to enhance patient care, streamline clinical workflows, and support medical research.
So I shall talk a little about the topic and how AI is impacting our life. What are the challenges in healthcare and how we can apply AI in nephrology? What are the caveats and the pitfalls of AI? And what is the role of ethics and how do we validate AI? As we are nephrologists, I would like to say, yes, chronic kidney disease we know is on the rise. And over the years, we have toiled very hard, but I feel that I don't see any reduction in the number, but it is only rising in, I don't know, it's just an exponential rise. And the most important cause is diabetes. And diabetes is just spiraling, it is increasing in number. And who is affected by this diabetes? It is patients who are in the poor economy. Now, we had gone through many revolutions, slow revolutions. We had found the fire, agriculture, cultivation, printing press. So many things have happened. But that was all slow. It took years for all these things to happen. But now we are seeing a very fast revolution. The age of AI, we thought we were intelligent. Are we going to remain intelligent forever? Is someone going to overtake us? Are we going to be there after years? That's a question. But we have to harness it. We have to know about this AI. AI is deeply integrated in our daily life, as you know, in all various forms. Whatever you use, wherever you go, AI is there. So AI is coined by John McCarthy as a science and engineering of making intelligent machines. So machines are made to become intelligent like man. As usual, we become a little tired and lazy, so we want some help. And we don't, so in that process, we want to make a machine intelligent. So why not harness the machine? The artificial intelligence, as I said, it is there integrated in almost all, in finance, in education, business, automobiles, manufacturing, whatever, you just name it. So what about us? Challenges in healthcare. Over the years, we see
Affordability of medical treatment has become unthinkable.
what about, in spite of knowing that there are so many disease or behavioral factors, patterns have not changed? Is it the lack of awareness, or is it why they are not, access to healthcare is not there? Or is it a shortage of our qualified healthcare, or we don't have enough infrastructure? So now, as you know,
The traditional medicine was trust-based medicine.
we used to trust a doctor, and that was how it was. Later, it has become evidence-based medicine. Now it is slowly progressing to precision medicine, where your molecules, your genetics, whatever, your proteomics, everything is taken into account, and for a person, we are getting the precise prescription. So how does it affect in AI affects the healthcare? We can target a person and give personalized treatment. We don't have members to help us out, so why not try and get virtual health assistants? Especially the COVID has taught us so many things. We don't need to meet the doctor directly. Why not use AI as health assistants for us? And then medical imaging, investigations. And then can we predict what is happening to our patient within 5-10 years? Or who are the persons who are going to develop renal failure? And now you also know COVID has we found new vaccine. This is because of drug discovery has been easy because of the application of AI. We can also optimize the treatment for our patients, and the surgeries has also been made possible. And what would remote AI monitoring? Like I said, AI can do anything. So what is happening? Our diabetic patients in remote places can't be monitored, and in real-time monitoring is happening because of AI. Earlier, it was called narrow AI, when you could just dedicate some robot to do some small tasks for you. Now it is going to think just like you, almost like you. It is going to take some decisions for you. But yet to come is super AI, when it is going to overtake man, our intelligence. As an introduction to artificial intelligence, what is it? It is something you're trying to enable the machine to understand things without human intervention. There is no need for a human. The machine is able to understand what is happening. The next is the machine learning, where there are algorithms are given. According to that, the machine can extract information, can find patterns, and that is how prediction is possible. And the next is deep learning. It is more of superficial when it is machine learning. Deep learning is when it's almost mimicking like our brain, when there are a lot of neurons are coming into action. So what happens? It is artificial neural network, when there is less than two or three neuron network. But if it goes more than that, it is deep learning. This is just an example, machine learning. I said you can predict something. You are teaching the machine that this is a car.
You can predict a disease or classify whether a disease is present or not. Here, you give a data set of different images of different cars. The machine learns that it is a car by looking at it and looking at various variables and identifies it as a car. Now you give a new image of a car and it is able to identify this as a car.
By using mathematical models, using so many factors, variables, they can find, like if you are diabetic, what are the variables that can say that you're going to develop diabetes or its complication. So that can be used. After that comes a deep learning, when you want to go deeper and know what is happening. Suppose it's just not, you don't want to know, you know it's a car, but is there anything more than that to it? More than the car, like what is the type of car, what is the color of the car, all this can be identified. So this is deep learning in medicine. Can you imagine, the diabetic patients, they have multiple problems, multiple organs are affected. You can feed all this. Do you see that there is an input layer and there is an output layer? There are hidden layers. And if you see 1 and 2, and then there is hidden layer of 250 layers, we don't know what is happening. And the machine is doing it on its own. By certain mathematical calculations, there is activation, weightage is given, and it will come and put a pattern and tell you this is a pattern, this is how it is. So if my patient is having diabetes and hypertension, and does it have any complication, they can tell the patient has retinopathy or no retinopathy. So this is what is the use of deep learning. So why has this all come up? We are drowning in data. The machine does not understand images or pictures of what you're giving. It only understands the numbers. That is why we are not able to catch up with it.
This is because of the growth of the computing power, and big data is the new plutonium.
So what is the importance? If you get a data, it is not just data that is coming. It is coming, when you're sitting at one place, I'm sure you must be getting a lot of WhatsApp messages, isn't it, within this second. So that is what is happening. It is coming with so much of velocity, data, and the volume, the variety, and it is the value also we have to take into account. So you can divide the data into two types, structured and unstructured. Structured is data is when patient has blood pressure, hypertension, all those, what should be checked, the weight and all is structured. Unstructured is what is the image. Some images come into your phone. What does it mean? You don't know. So those are things which you cannot say, label them. It is called the unstructured data. So what do you mean by big data? Big data is a term describing large sets of structured and unstructured, semi-structured, continuously generated at high speed and in high volume. So volume, velocity, variety, and veracity. You can see our sources are many: genomics, labs, imaging, medical records, medical devices, whatever you're utilizing, your mobile apps. And also, most importantly, we as doctors don't have time to find out about the social determinants. So many things can be stored. This is what I meant. We are getting data. You can get real-time data, continuous data. So we have a lot of data, but we don't know what to manage. because it is beyond our capacity to understand how to utilize this data, and that is why the machine comes into play. Along with artificial intelligence, it is called the new ChatGPT. So it is actually developed by a company, OpenAI. It's a tool, it's just a tool. Just like this, there are other tools. But what's the disadvantage of ChatGPT is, it is actually contains lot of data over the years, but it is not updated. Maybe the past 6 months or 1 year, it will not have the data. But if you ask about anything, it will give you the data like anything, like as if it knows everything. Have you tried ChatGPT? If you do that, you will know that it will go on continue. You ask about what is the weather, it will go and tell everything about it. So just like that, anything, it is non-stop. It is because it has been trained like that. But now to overcome that, the Google has come up with something called Perplexity, where ChatGPT and Google can use so that you have the latest data. So just like ChatGPT, there are other AI tools as well, like Claude 3.5 Sonnet, you have Gemini. Like that, you must be knowing of the Copilot, and you must be seen in your WhatsApp the Meta. So how can we apply this for our patients? We can help for diagnosis, for clinical decision support, prognosis, as I said, treatment planning, patient monitoring, and also importantly, organ allocation. So like just yesterday we had a talk by Dr. Priya Alexander. She had told us about how useful it is, the AI tool they are making use, pathologists. Just like that in the clinical side, can we not use it for early detection and diagnosis of kidney disease? We know there are certain conditions. Maybe we are missing certain patterns, certain things we may be missing beyond our knowledge. There are ways to detect. So they have utilized how much? 7 lakhs. Can you imagine doing that in your computer with this? No, this is beyond our normal statistics. So this is different from studying, this is different from statistics. Statistics is where you create a research question, then you make a hypothesis, and then you try to prove or disprove. But here it's not like that. From the data, you are finding out, is there a pattern? Is there something connection? Is it connected or not? That is what we are doing. And to prediction, maybe if it's more than 60%, it may be useful, but the thing is the machine keeps on learning. Maybe it may be wrong initially, but as more data comes in, it learns more and more, and it becomes much more, the model is much more better. So that way, similarly, predicting hospital outcomes. So all this, if you see, the data is a large number. How can you predict oliguria in patients who are critically ill? Certain parameters they have found out. Because of large data they have collected, they have seen some urine values, creatinine, the oxygen partial pressure. So using certain variables, they could say, yes, this patient is going to develop oliguria. Isn't that great? So we can take steps to prevent progression of the kidney disease. Similarly, there are other studies that have done. Can AI predict future AKI? This is similarly data set. What they do is, with a large data set, some will be put into training, and then validation will be done, and then we have to calibrate and do. There are certain procedures before we create a model. With this data, you have a huge data, you create a model. And then you can test this model with a new data set that you get. That is how it's being used. Of course, importance in, yesterday the ma'am was telling about the importance in detecting how sometimes they go wrong, whether it is rejection, whether it is pyelonephritis. So they are utilizing AI for what? They just easily, the AI will tell you how many glomuli are there. It will tell you how, is there fibrosis or not. All this thing can be utilized easily when you don't want to strain too much. So this can be utilized. Similarly for diabetes, we may be missing what is the cause for renal failure in diabetes. Studies have been done where they have done data extraction. Similarly, can we say whether the patient is there progression of kidney disease or not? Why not try this?
Making models on our own.
You must realize whatever models they say, it cannot be utilized for our area. Whatever is happening in Trivandrum, I cannot use in Wayanad now. So wherever you are using, it actually depends on the area where you are, what sort of people. So many things are there, so you cannot utilize the same model everywhere. That is something you must remember. So everyone must be knowing about how to predict IgA nephropathy and its complications. Similarly in dialysis, we have a lot of data, if you know. You know that the patients have been on dialysis. We would like to monitor whether they're going to develop cardiac disease or not. Why not have some biosensor when they go home, and you'll get online monitoring, real-time monitoring. So all those things can be utilized. And also they have tried to do how much of erythropoietin is used so that you can reduce the use of erythropoietin. So there are so many advantages, and definitely by organ allocation. It's very difficult when you have all over India patients. We want to donate organ, but which patient is the right patient, getting it at the right time? The time is very important and the organ is important. There are caveats. For everything there is something negative, isn't it? We always have to find something negative. Have you heard of that ChatGPT can have hallucination? Do you think a machine can have hallucination? You ask some question today and it tells you something else. Yes, it does happen, because it goes on generating on its own. So that is something you have to be careful. Maybe 55% of the time, of more than 50% of the time, it may be right. Maybe you're not asking the right question. So they could, if you see the ChatGPT, you can ask a lot of things about transplant. It will give you correct which is a journal it is coming from. But sometimes if you cross-check, it is not correct. That is something you have to be careful. But certain words are good. You can utilize those words, but you should always make sure you cross-check now. So you should remember that it can also distribute misinformation. But there is something else also. Now something else comes because of that. What is that? Prompting. Whatever you're asking maybe is not correct. The question you put is not correct. The word you put may not be correct. Probably that is why. You have to know the art and science and craft of it. There are courses called prompt engineering where you have to put the effective input so that whatever you put should be clear, concise, relevant. Otherwise you will get a wrong answer for sure. We are bothered about the ethics, how, especially data privacy. We are loading a lot of patients' data and the bias can be there. What about transparency? You know that I told you about the black box. We don't know what is happening in between in the neural network. That is called the black box. It comes out with some values, how it is, but we have to believe. Whether if we want to believe, we'll believe. So clinical validation is also required. We need the human in the loop. Human also should be there. You cannot just simply depend on the data. So you have to try to reduce the bias, think of what are the ethical problems that can occur. We know the diverse data that is there. It should be transparent, and definitely doctors, patients, we all should be able to trust such findings. Biases can be anything, can be the training data bias, what you selected may be wrong, what you're representing, maybe the people you are representing, maybe of this hospital, you cannot apply to other place. Lot of reasons, a human bias can be there, cultural bias can be there. It may be an outdated data, so temporal bias, so many reasons for bias. We should be aware of this. And for that, we always have, just like any knowledge, we'll have to put testing. So these are testing for validation of, suppose you, like I said, like ChatGPT, is there any, we have to find out whether it is valid, whatever it is, valid or not. So we need regulations, establishing regulatory works, accountability, data privacy, and all has to be taken up. AI is coming. We have in India,
Bharatiya Nyaya Sanhita 2024.
So we are also coming with it. So future is there. Definitely we want to go along with it. Future of AI is definitely there. We must think of, should be a human in the loop. You cannot just leave it to the machine. We should work along the machine, and we must be curious and adapt. We have adapted as humans, we have adapted. We cannot just ignore it. We have to be ready for this.
At present, I should say, AI should be considered as augmented intelligence.
With this, I conclude. I hope you found this talk informative and inspiring. Thank you.
Thank you, UNNIKRISHNAN. It was a very great talk. So, seniors would agree that, we have gone through various, stages of technology, like having a phone, only one phone in the entire colony, and then moving on to individual houses having a landline, and then to a mobile, and now we have these smartphones everywhere, and now moving on to have this all artificial intelligence and everything. So I think admin technology is fast advancing, and whatever we learn today has become obsolete tomorrow. It's so fast. having said that, I think when being in the healthcare sector, it's our responsibility to learn and use this technology so that we can have a better patient care. And you have very well highlighted how, as a nephrologist, we can use artificial intelligence in our day-to-day practice, including the prediction models and then diagnostic, and then with the imagology and using in administration for a better patient care sitting in remote places for telemedicine, and then having it in organ allocation guidelines, and of course using it in research. I think it's very well said. Being in a transplantation, I would like to know how we can use in organ allocation. Is there any actually existing models? The other thing is I wanted to emphasize, which I have probably could not cover. What is dialysis? So we have Telangana has a very good model of hub and spoke dialysis centers, and we sitting in our room, we can actually, the individual machine has been attached to what you call the our software. We can real time assess the dialysis parameter, including the blood flows, the BPs and everything, and all the peripheral dialysis center. So that also in dialysis also we can use this artificial intelligence. So at the end, I would like to say is whatever artificial intelligence evolve, ultimately we should have a human brain. Otherwise, as you said, there will be a lot of. And recently we have experienced even the Air India, not the Air India, the Indigo. There was so much of chaos, because the softwares were shut down, and internationally it was few hours. It was a major chaos. So I think the human brain should always be active, despite whatever artificial intelligence or generative AI has come.
So the question still remains: are we geared up? And is this what is going to happen? Can you project that on that side? Yeah, that's a very good one. I think we must have seen in WhatsApp by now.
I think the artificial intelligence should be helping us to make things easier, and it should not be replacing us.
So the word now is augmented intelligence. We should augment the use, so augmented intelligence.
Just to add, ChatGPT makes beautiful discharge summaries.
Yes. So that is what, it saves our time. Definitely, efficiency, looking after a patient, so many things it takes care. Even if the patient comes to your OP, you just ask the patient the complaints, and you can, the new phone itself, the speech is converted to text. Understood? So it's all there in the computer. You just got to talk to the patient, you examine and you just tell, it's all recorded. So you have time, efficiency to work and look after the patients as well.
Only thing, how far it's going to replace clinical experience? We have senior faculty sitting here, and how far? Something like, are we going to do it with the CPC is going to happen in the future conferences, where the pathology is taken over by AI, and even the clinical experience is going to take over by AI?
You cannot compare. It's not something you can compare. I don't think so. Because yesterday ma'am was saying how useful it is.
The topic of often discussion and comments.
And the decision what the AI gives you, legally what is valid then?
That's what, we still don't have ethical and legal issues we still have to face. So definitely the human is important. The human takes a decision.
Manisha, I think
we don't go
it is
by
the individual, because we have to give the prompts. Only then, so we are giving that prompt, so we are responsible. So whatever
And I
information
think humans will never be replaced, because see, if you feed something, the machine goes by the algorithm and you get an output. Output may be the same for two different people with different socio-economic strata, and the clinician's decision may be different from them, where AI will give the same
Definitely, even
opinion.
among doctors, we have
That's
different
true, that's
opinions. So it all depends on the patient who sits before you. That's more
Excellent,
important.
excellent talk. Thank you.
Thank you so much.